The Asian Pacific American Network of Oregon asks, what's your healthcare story? APANO asked a group of Asian and Pacific Islander community members.
My name is Jennifer.
My name is David.
My name is Anselmo.
I'm Andrea. My name is Madeleine.
Questions about their unique and diverse experiences in accessing healthcare to better understand what works and what doesn't work to keep our communities healthy. APANO asks, have cultural values affected access to healthcare for you and your family?
I would have to say it's not so much a trust issue. It is a cultural barrier where they're not used to. They grew up not going to like someone that has a title as physician, doctor. They're used to going to someone who knows how to use like plants within the village to make medicines, remedies that heal. That's one of their beliefs. So when it comes to like my dad or my mom getting sick, they're used to like getting plants around them or abalone and just stuff from the ocean to kind of make medicines that they can either drink or that they use oils and they rub along their body to heal. Like that's what they believe as medicine. But when they come to the States, it's like, why would I go to a doctor who doesn't know how to make those like remedies from plants to heal me? I can wait until I go back home, which is when are you gonna go home? So I believe that's one thing that my parents believe, especially my dad. That's how he sees it. He doesn't expect like the medicine that he gets from doctors to work immediately. Like he thinks the remedies from back home work immediately on him. So that's one cultural barrier that I've seen when it comes to trying to get my dad to go to the doctor. I would say that's the main one, is just like his belief of the medicine not working and the people not knowing how to treat his sickness.
I think that it's interesting being a PhD student right now in counseling psychology and knowing what my training will provide and knowing what my training has provided. We don't get that. And I only know what is relevant and what is important to the Chinese American community, but I don't know what it's like in the Filipino community. Right. I don't know what it's like in the Korean American community. And I don't get that training even within the Asian American community of what do I need to do as a future mental health provider, of how do I provide those kind of services. And then of course expanding that out, I don't know at all what it's going to be like for me to provide those services to a Latino community or to the Black community. And so I think that is a huge gap even in the education and the training of health service providers, that we don't get that. And in terms of language or culture, we don't get nearly as much training as we would like. We have in our, here at the U of O, we have one class that we receive on counseling diverse populations, and then maybe in one of the classes that's has some sort of diversity, like school consultation, for example, we get one day out of a 10-week class where we have the diversity day, where we talk about like what's going to be like to counsel diverse populations. Right. And then that's it. That's all we get. So I can see why our healthcare providers don't have that.